Good evening, and welcome to something we don't do very often because we're in unprecedented times. We're doing a virtual town hall with some of the health experts in the Champaign County area. I'm State Senator Scott Bennett, along with State Representative Carol Ammons, and we'll introduce the rest of our panel shortly. We're here tonight to talk about the novel coronavirus, or the COVID-19, something that the World Health Organization today classified as a global pandemic. In part because there's a lot of misinformation out there, and we're hopeful that by one, addressing some of the myths and correcting those, and two, talking about some of the steps that actually our local governments and local health departments have already taken to address this concern, that we're going to bring hopefully some certainty in an uncertain time. And with that, I'm going to turn it over to State Representative Carol Ammons.
Thank you. We wanted to make sure, Senator Bennett and I want to make sure that our community received accurate information. We have gotten, and you've seen online, all kinds of videos. We have people allegedly trying to sell medication for this. There is no actual medication for it at this time. And I know our Director of Health, Ms. Julie Pride, is going to clarify that for people. We also want to make sure that you received a notice from Kwame Raoul, who's the Attorney General for the state of Illinois, who sent out a resident alert today. According to the CDC, there's no vaccine to protect against COVID-19 and no medications approved for treatment. If someone calls you allegedly having a cure or treatment, please hang up and notify the authorities that you have received that call so that they can trace where these are coming from. This week also, Governor Pritzker issued a disaster declaration for the state of Illinois, and along with the Illinois Department of Public Health, is providing regular updates on COVID-19 in Illinois. With that, it is my distinct pleasure to introduce to some and bring back for others who may already know our Director of CU Public Health, Ms. Julie Pride.
Thank you. I'm going to go ahead and introduce the panel, and we're going to talk loudly for Facebook Live. I'm going to introduce the panel, and then we are going to take questions that have been submitted. This is Dr. Janet Jokola. And where are you from, Dr. Jokola?
Thank you, Julie. Hello, everyone. I'm Dr. Janet Jokola from the University of Illinois College of Medicine here in Urbana-Champaign. I'm infectious diseases by training and also the acting regional dean for our campus here.
And Dr. Robert Healy from Carl.
Yeah, my name is Bob Healy. Thank you, Senator and Representative and Julie. I'm from Carl Health System, and I'm Chief Quality Officer. I'm a physician. I've been, with others, leading our response to this COVID-19 pandemic.
And John Dwyer, who is the Champaign County Emergency Management Agency
Coordinator.
Coordinator. Okay.
So, thank you. Thank you all for being here. So, as the doctor said, we've been doing a lot of planning since September, working with the university, especially with the students coming back from winter break. So there's still more work to be done. So we're glad to be here to answer questions from the public and take advantage of this opportunity to dispel rumors and just make folks aware that we're doing what we can with what we have and looking forward to the future.
Hang on, I'm going to pause. You have to speak loudly because people can't hear. So speak directly into a microphone. Sorry.
Pull your mics up.
So we can alternate questions. Do you want to start, Senator Bennett?
All right, we've of course got submitted questions. We'd like to, and anyone could kind of can answer as you see fit. The first one is, there is so much news coverage about testing, but how is the virus currently being treated, and how effective is that treatment?
Right. I'll jump in for that, and thank you so much. Thank you, Bob. So in terms of treatment right now, there is no specific treatment for COVID-19. Treatment is what we refer to as being supportive. So this is things like nutrition, IV fluids, Tylenol, things like that. But there's no specific medication for the virus that's available at this time. So.
Thank you.
Yep.
If this new vaccine is fast-tracked, as the Trump administration is proposing, there will be no time to run a placebo-based trial and other safety protocols. What assurances do we have that a fast-track vaccine will actually be safe and effective?
That's an excellent question, and thank you for asking. In terms of the vaccine development process, it's actually something that takes many, many months and up to a year plus or so. What's really amazing regarding this current outbreak is that vaccine development is already well underway, and it's expected that the initial vaccines are expected to enter phase 1 trials in the next, what I've heard, in the next few months or so perhaps, and that's unbelievably fast. Absolutely unbelievably fast. And so with phase 1 trials, those trials are designed to test safety, exactly the question that our questioner was asking. So they're first designed to test safety and dose safety and that sort of thing. And then after that, they will enter phase 2, which goes on to look more at efficacy and how effective are they, that kind of thing. That will take another 3 to 4 to 5 months. So this is a multi-month process. So indeed, vaccines are under a vaccine is under development. It will enter trials relatively soon, in fact, amazingly soon. But in terms of being available for a broader rollout for the population, that's many, many months away.
And let me clarify that people who are watching by Facebook Live, you can still submit questions there. All of these questions have been submitted in advance. My staff is saying, well, you may not be able to submit questions, but what we will do is we will post this available to you, as well as Julie Pryor will make additional information available at the Public Health District website.
Next question. We've heard a lot about how quickly the coronavirus can spread. So how can an individual that wants to seek medical advice or see a doctor or get tested still protect the community from possible transmission at a healthcare facility?
I'll take
Sounds
that
like a Bob question.
Yep.
So thanks for the question. It's a really good question. I think the most important thing is to call ahead. If you suspect you might have the new coronavirus, which causes COVID-19 disease, you should call ahead to your primary care doctor or to your facility. I know Carl and others have 24/7 telephone lines that you can call. You would be triaged. That means they would ask you questions about your symptoms. Most people, 80% of people who do get this disease are going to be able to treat themselves at home with fluid, rest, the stuff your mom told you about, chicken soup, etc., Tylenol or acetaminophen or ibuprofen for fever and aches and chills, and they won't have to come into the office. If when you call in, there are certain things that tell us that you might be sicker than one of those 80%, then we'll direct you to come in. If you're asked to come into either the office or an urgent care or convenient care or the emergency room, the most important thing is to let us know you're coming and mask before you enter the building. And we'll have masks in the stations out in front of our emergency department and in front of our primary care buildings, and we want you to mask so that you're protecting others in case you actually do have this new virus. So the question was about how to protect others in a healthcare facility. As the questioner probably knows and others know, there's a lot of really sick people in the doctor's office, in the hospital, in the emergency department. So thanks for asking this question, and protect others by calling ahead and wearing a mask.
Thank you. Julie, can you explain, to the best of your knowledge, how many cases that you're aware of in the community and how many of them have had access to testing either by request or by necessity?
Okay, I can tell you that we've probably had 100 people try to get testing, and even from physician referrals and things, but the federal testing guidelines are so narrow right now that we have had a handful. I mean, we've had under 20 now that have been in for testing. All of those that we have received back so far have been negative. So we have no confirmed cases in Champaign County at this time.
Can you clarify the federal guidelines, what you're under right now?
Sure. So normally, the public health measure that we want to have at the beginning of anything like this is availability of testing so that we can cast a wide net. We can find everybody that may be infected, and then we use public health measures of isolation for the sick, quarantine of the exposed, and then contact tracing. So, that's all very important, and what it's doing is removing sick people or exposed people from the public so that it slows the transmission. With this, it's been just exactly the opposite. We have so little testing. There is testing at the state lab, but the guidelines to get someone in, physicians can't even get them in. I mean, they have to go through public health, which is a slow process. It's not that we don't immediately turn it over, but if the state says that you have to have, like right now, you have to have a travel link to one of the specific countries plus the symptoms. And so that is making it super narrow. Then we are also a sentinel testing site at Carl, and that means that, again, it's still narrowing it because people have to go in, they have to be sick enough to go in, they have to also have a negative flu test, which is we're only doing that to limit the testing because there's no need for that, because you could actually have influenza A, influenza B, and COVID at the same time. So it's very frustrating, and that's why we're seeing some of the problems that we're seeing. If you look at like South Korea and Taiwan and Hong Kong, they have done an amazing job. They cast the wide net, they tested everyone, and they were able to contain.
Could I add to that?
Mm-hmm.
I just wanted to mention about the sentinel testing, which Carl's happy to be a part of. What the public health has asked us to do is, if someone comes to the emergency department like they normally would because they think they're sick enough, and they have a flu-like illness, and the provider at the emergency department thinks they need a flu test. Those aren't always the same, because sometimes there's other explanations for the flu symptoms. But if a provider at Carl's emergency department in Urbana suspects or wants to know if there's flu or not, they could send off a test looking for that flu. If that test comes back negative, behind the scenes, our lab is sending those negative tests with local public health's help to Springfield to get tested. And this takes days for us to get the results. The real reason to do this is to find out if there's already spread of this virus in our community, which we don't have any evidence of right now, although we suspect it might be happening.
Oh.
What I want to really hammer home is we don't want people, and this is not going to work, if you come to the emergency department and say, I want to get one of those tests. Right. Because if the physician doesn't think you need a flu test, then you're not part of this possible sentinel study. So we don't want people thinking that Carl's testing for the new COVID-19, the virus that causes COVID-19. Carl's taking place with public health on the surveillance itself. Thank you.
Correct. And if we had all the testing that we wanted, we would be doing that. And if we do get access in the near future to a lot more testing, then we will expand those guidelines, but we cannot right now. So we do not want people going to the ER or even to their healthcare provider and saying, test me for this, because the healthcare providers have no ability to do so.
And if I could, I'm sorry, one more time, or one more thing. We have seen, and other emergency departments have in our community, people being sent to the emergency department by a primary care office or by an employer because they think they might have traveled or they're coughing. And again, being sent to the emergency department for testing just isn't feasible right now. Right. We aren't doing testing on people just for showing up in the emergency department. And nobody in Champaign-Urbana is doing the testing. It's all being sent to the state lab.
Yep.
Okay. Dr. Healy, both you and Julie mentioned the flu as we're talking, and something that I hear a lot, and I'm going to guess many of our viewers have either wondered or have heard, is why such alarmism? Isn't this just the flu? Isn't this what we see every winter with the seasonal flu? How is this different, Julie?
I will take this one. Okay, so yes, the flu is a very serious disease, and we constantly try to get people to pay attention to that and get their flu shots. People die from flu every single year, and this year it was especially bad on children. And it also takes up a ton of hospital resources. The difference between flu and this new pandemic strain of COVID-19 is that no one on Earth has immunity to this. So there's no immunity, there is no vaccine, there is no treatment. So what we're trying to do with all these extreme measures that you don't see with flu, because flu is vaccine preventable, what we're trying to do all these drastic public health measures and closings and things is trying to limit the epi curve from going like this, where you have just a ton of cases, and that overwhelms the healthcare system. If we overwhelm our healthcare systems, we're going to start seeing people dying from appendicitis and heart attacks and in car accidents, because you cannot overwhelm your healthcare systems. This is super important. So we're trying to keep the transmission as low as possible until we can get to a vaccine.
Jen?
Thank you. Just to add to that, and that's all spot on, just absolutely spot on. The additional issue with comparing this, say, to the flu is the severity. It appears that this is more severe in its impact and in terms of clinical severity, even mortality, than regular annual influenza is. So it's all those things combined together which make it so pressing.
So just one follow-up on that. Related to the seasonal flu, is it thought to be the same contagion level? I mean, is it as easy to catch COVID as it is to catch a seasonal flu? And once you've had it, can you get it again?
That might be a tag team here. I want to go back to the difference with the flu. The flu, as Julie said, and Janet talked about, it kills tens of thousands of people a year. In Champaign-Urbana, and I'm a primary care doctor at heart, so I really want my patients to get preventive health care, and I would love them all to have gotten a flu shot. But I think that the community average is about 45% of people. So of all of you out there, 45% have gotten a flu shot this year. We should make that a lot higher, because we can protect ourselves and not have to say, wow, I wonder if I have the flu or if this could be this new virus coming around. So that's an important thing.
And we don't need the hospitals overrun with flu cases like we
Exactly
are
right,
this year.
because we have people in our ICU who have the flu right now, and we wish they, not that getting a flu shot is a magical cure, but it decreases your risk from getting influenza bad enough that you'd be in the hospital. And there's people in the hospital and in the ICU who have gotten a flu shot. Again, it's not 100%, but it's something we could do and we should be doing every year.
Yeah, and by the fall, we have got to, as a community, make it a point to understand that community immunity is everyone's responsibility, and it will help our healthcare system, it will help you, it will help you from passing it on to others. So before the fall and winter roll around, we are really going to be stressing flu shots.
One more thing about severity, just looking at facts, in Italy right now, the death rate is approaching 8% and probably going to hit 10%. That's 100 times worse than the flu. So saying this is like the flu is completely wrong. This is much more serious than the flu.
Can I ask our EMA director just a clarifying question? What conditions will determine whether large-scale events ought to be postponed or canceled, school or workplace? We've seen today a number of mass cancellations are taking place. What should people in Champaign-Urbana do? What should we be concerned about around church meetings and community meetings and other things of that nature?
Look at alternatives, because that's what the colleges are doing, online learning, as well as looking at alternative methods to host conferences and things like that, but also work with public health. Some things can't be avoided, some gatherings can't be, public meetings and things like that, but it's more so doing what we can to limit the exposure. So we're not recommending or with public health to close anything, but just looking at alternative methods to deliver services or meetings and things like that. So right now, the marathon is still scheduled, but they are considering alternatives as well as they're looking at what's going on with the virus. Is it coming this, is it hit this way, or what's the community spread? So they are taking it into their considerations for future planning. So. And
I'm doing my part by not running in the marathon.
I'm going to join you.
Let me continue with a community-based question. People are seemingly panic buying. Is that a real thing, right? Should people stock up everything in their garage right now, emptying the shelves at our stores? What's your best advice about this preparatory work here?
I would say prepare for what you can, if you're going to have to stay home for a few days as well as your children. But we know as a fact that many people can't afford to do that. We're also, the state's working with the Department of Insurance to see if folks can get their prescriptions, get more than their normal regimen. So there are small things that people can do to prepare for disruptions, but try to do what they can within their means to stock up, but don't go into debt. But it's one of those that we are working with special populations to try and advise them what to do. But do what they can, what they got, and also be a good neighbor. Now's the time to make sure that you check on your elderly neighbors, your folks that may have disabilities in your community, and see if they have any needs. This is a good time to do that outreach and be that good neighbor.
Yeah. And you will probably hear us, not just public health, but public health and the hospitals and EMA and the mayors and politicians of all kinds to, at some point, we're going to go and we're going to say, we need your help to help those who cannot help themselves. And it is important, and it is not panic buying. What I keep telling people, preparedness is not panic buying. Panic buying is when you go to the store and there's nothing there. That's when you start having panic buying and you start buying stuff off the internet. Don't be pulled in by trying to get hand sanitizer or Clorox wipes. There are cheap alternatives to all of that stuff, and hand soap works fabulously. You do not need any fancy hand soap. Even the little crappy bars you get from a hotel are just perfectly fine. So it's the mechanical action and the slickness of the soap. You don't need anything special.
That was
20 seconds.
That was my question, actually, related to hand sanitizer. If you go to a store today, as I did after I talked to the state public health, sanitizer is missing. There's plenty of hand soap.
Yep.
And so my question was, and you've started to answer this, there's lots of different hand soaps, antibacterial, others. Is there any purpose to any particular soap? And it sounds like any soap is fine.
Any soap's fine.
And that is an overlooked possible remedy to avoiding the coronavirus, correct?
Yep, plain soap is perfectly fine, and it's the rubbing of the hands. The rest of it's marketing.
I truly appreciate Julie for that very clear perspective. Please don't run out and buy all the hand sanitizer and alcohol at Walgreens. It's not necessary. Please just wash your hands. Be careful. Don't touch other people if you don't have to. Some of the same things we would do if a person had a cold, flu, or any other sickness. Some of the questions that we received today also asked this, and I'm asking it because it was asked to us. How long after people in Champaign-Urbana start getting sick, or you notice that they have the actual COVID-19, how long do you expect this epidemic to last? When will it be over? This is what people are asking. How long will it take to get back to normal?
Oh, from actually being sick, or
From
when are
being
we going to be
actually
done with
sick.
the pandemic?
Yeah.
Oh, well.
I know that's a question you probably can't answer, but that's the question that was asked.
We can look to other countries, and Dr. Jokola can speak to that.
Yeah, it's a great question, and it sounds like perhaps there are two questions in there. One is the overall community pandemic and all of that, and then the other is for like an individual person who, say, may be sick. The information is still evolving, but it appears that people will recover in about 2 weeks or so is what my recollection in terms of what I remember hearing about that. And again, it will vary from
Healthy people.
Healthy people, that's right. And we'll learn more as this all unfolds. So for a healthy person who gets sick and recovers, about 2 weeks or so. For other folks who are more seriously ill, who recover, it may take longer. So 2 to 3 weeks, but again, that's a moving target. We'll learn more as we get more information.
And is it your expert opinion that right now in Champaign-Urbana, we just don't really have a good number of how many people are actually sick with this? Or
That is correct.
That's right.
We are
That's
flying
exactly right.
blind. Without enough testing, we are flying blind. We are actively looking for alternatives.
And have you gotten any, I have not seen a release yet, updating from the State Board of Education yet. Have we received anything here locally in preparation for our schools in relationship to the State Board of Education?
Well, I don't know if anything's come from the State Board of Education, but I know tomorrow we're meeting with all the superintendents of all the schools in Champaign County, and we're going to be discussing everything from, sanitizing to social distancing to closure, the whole everything. But I will tell you that our community is already working on looking for what happens to the 9,500 kids in our county who rely on free and reduced lunch. For some of these children, we know that that is their one meal that they get a day. So we are actively looking into this. I know that Mayor Marlin is going to go and talk to some places about this, including United Way, and seeing if we can get what we need to get those children fed. We've had the public health dietitians have put together a food list. We've figured out ways to do get the boxes put together so that every family on free and reduced lunch would get a 2-week supply of food for the whole family, for a family of 4. And then, so we're moving with that, but that's when we're going to be asking for community's help. And there will be a lot of logistics to do that, and it will be drop off or drive through, because we do not want people to congregate.
Representative Ammons, I think your question was 2 parts. It was a great question that the person who asked it, and that is, if I get COVID-19, how long will I be sick for? I think the other question, either implied or stated, was how long will this epidemic last when it hits Champaign-Urbana and our surrounding communities? Just a few facts, and these are, so much is unknown about the coronavirus, the new coronavirus. I tell everyone I talk to, this might change next hour.
Mm-hmm.
It really is moving very quickly. But the estimates are that when it becomes widespread in Champaign-Urbana and our surrounding communities, 30 to 40% of us will get infected, which is a huge number. And 80% of those will be fine at home, taking care of themselves at home, but 20% will need to be hospitalized. And as we look at these numbers and do some modeling, we quickly reach a point where we don't have any hospital beds left or ICU beds left. So it's critically important for us to what's called bend the curve. Julie showed earlier how all of these events, all of these illnesses can happen at once over like a week or 2 period, or we can smooth them out over the next few months. If we smooth them out over the next few months, our community will be better for it because we'll be healthier, and our day-to-day operation in the hospital, although being affected, will be able to go on while we care for the sick people with COVID-19. So I don't mean to be alarmist, but I think there's, I don't know if there's been as good of transparency out there as there should be with this data, with these numbers. And we at Carl are preparing for that worst case scenario and what might happen. It's sobering.
Yeah, and it's important to know too that this is worldwide. Like when we have a tornado, or when public health had to deal with the measles outbreak or the mumps outbreak, I was able to reach out to all the other counties around us, and they sent nurses to help. They sent staff to help. When we did the H1N1, all the hospitals and clinics sent people to help vaccinate. In this situation, everyone's in the same boat, and we're worrying about running out of supplies and personal protective equipment, and that is key. And if you get, with flu, at least healthcare workers on the front lines are able to be vaccinated to prevent this. With this, if we lose a bunch of healthcare workers to sickness or isolation or quarantine, that is another compounding factor that makes this scary.
I have 2 questions, because one I think I already asked, but I don't think we got an answer on. In terms of contagion,
Yeah.
so say I contract it and give it to my kids, okay? Can they give it back to me? Am I as likely to catch it as a virus, or is it one and done for me?
Yeah, great question. The presumption is, and again, we don't know all these details just yet, but the presumption is when someone gets it, they develop immunity and then they cannot get it again. But that's the assumption. But again, we'll learn more as we go on. Beyond that, it is quite contagious. We're learning more and more about that. It does appear to be very contagious. It's spread in the same way as the flu, so with coughing, droplets, sneezing, and all of that. The tricky part with this, which is also a bit challenging and a bit of a conundrum, people can be contagious before they develop symptoms. So again, in addition to the numbers and things that Dr. Healy was just talking about, that's sobering. So when you think about how to try to contain this and how to mitigate this, the fact that people can spread it before they have symptoms is a real challenge.
some of the statistics you've given, obviously it's newer to the United States. And I know we've heard, several theories that, so for example, certain statistics that they got from China can't be extrapolated to project here because of smoking rates or socioeconomic conditions. My question is, are the patterns we're seeing as it begins to spread through the United States, does it mirror what we're seeing globally in the other nations where it's present?
Yeah, again, that's a great question, and it's hard to say just yet. The numbers are increasing here daily, as you know. In fact, today there's twice as many cases reported in the U.S. as there were 2 days ago. And, in some ways that's not surprising because there's more testing that's being done. So, we're finding cases of that have been here that just we didn't know about. That being said, there's just unbelievable things that are happening in Italy, as an example. For a whole country to be shut down in Europe in that way is mind-boggling, frankly. We're going to learn a lot from them in terms of all these kinds of details in terms of transmission and infectivity and all of that. And it's just a little hard to say. I think what we've seen so far, especially with the nursing home in Washington State, that it appears to be very similar to what's been seen in other parts of the world. There is some talk about different genetic strains being circulating now, and they may have slightly different levels of infectivity and virulence. We'll learn more about that as this unfolds too. But again, so far it appears, at least preliminarily, what we're seeing here in the U.S. does mirror what's happening in other places. And in terms of being contagious, again, the data's evolving, but it appears that it's about 24 to 48 hours before someone develops symptoms that they can actually pass the virus.
And is this, we see a lot, as you said, Washington State, we see a lot among the elderly. Yeah. And so people are starting to say, oh, well, I'm young and healthy, don't worry about me. It's not really something affecting the young people. Or some of the, we got a question about, should we be concerned about our students from other countries, which is something that came in during this process.
If I could, I don't think so. No, we shouldn't be concerned about students from other countries. If someone has a recent travel history, no matter where they're from or what they look like, they could be at risk. So that's important. But what we really need to be careful that this isn't a certain person gets this disease. It's humans get this disease. Going back to the data, Senator Bennett, you mentioned, are we unique? It's not really going to happen like around the world here, right? We have such a great healthcare system. It's true, we do, but there's flaws with it, of course. However, if you look at Italy, they have more doctors per person than we do, and they have more hospital beds per person than we do. They also have a lot older of a population, and if you look at the statistics, people starting at age 60, the curve for your death rate starts going up dramatically. So younger people are at less risk of death from this disease, and that I think we all breathe a great sigh of relief because of that. However, if someone gets it and they're young, they're in college, they're in high school or younger, they're putting all the 60-plus-year-olds in our community at risk. So we really, even though the risk is lower for someone younger, thank God, the infectivity is the same for that person. So there'll be 2 or 3 people that they infect, just like if someone who was 80 would infect 2 or 3 people.
Yeah. Now I have to go back to the question about, should we be concerned about, students from other countries, for example. I have to say that at the very beginning of this, and at the very beginning of a lot of outbreaks, when there's an unknown, so we could have had an outbreak here when people were first coming back to school from Wuhan, China, for example. And I have to give a shout out to the University of Illinois because they did an absolutely amazing job of contacting people, communicating with people, putting people in isolation or quarantine, and they did just an amazing job. And so that started early, and that was when we did our first talk on this, and we were hopeful that perhaps it could be contained, because if just a few, sparks, if you will, come over here, a few cases, public health can contain them. But once we saw that it was getting out of China, then we knew, right then, we knew that it was going to be a pandemic, because there's no stopping it once that happens. It's only at the very beginning. And I think we didn't have a localized outbreak because of the steps that the U of I took and McKinley Health Center.
And certainly for yourself and EMA, okay, here we are, and now we get more testing kits and we find more cases, and Carl is working on those cases. What is the authority of the public health and the EMA in directives to the citizens of Champaign County? What is the authority level there?
Okay, so the authority that public health have, not just here but everywhere, so you have the authority to isolate, we have the authority to quarantine, we have the authority to close things, we have the authority to, so those are the authorities that we have, and we would work with certainly EMA, and where it's not just, public health has that authority, but we don't work in a vacuum. So we are constantly meeting with elected officials. The emergency management has something called the Regional Emergency Coordinators Group, where we've been working with them from the beginning of this, with the University of Illinois and Carl, and a lot of the infection control people have an infectious disease working group. All of them have been working together. So unlike most public health departments, I have an amazing array of experts available in this community all the time, and Dr. Jokla has been talking me out of a tree all through this.
Well, we are in a community that we're lucky to have so much access.
We are.
Well, and we'll just say the same goes for Julie Pride, who's been doing a phenomenal job leading our county health department.
Thank you, Jim.
We're all lucky.
Yep.
All right, well, we've heard a few coughs from panelists in the last few minutes, and of course, it's cold and flu season. So if someone feels like they at least have a cold, should they stay home from work if they feel sick, but they think, I don't have a fever, I'm just a cold? Or is it okay to go to work as long as they don't visit elderly relatives?
Stay home if you're sick.
Yeah.
That's the
ditto.
message.
Stay home.
And of course, the compounding factor in that is that if I stay home from sick, I'm still going to get a paycheck. Right. A lot of people do, but there's a ton of people out there who don't. And we have so many outbreaks in food service and other things because people cannot stay home when they're sick, because if they do, they cannot feed their children, they cannot pay their bills, they cannot eat. So paid sick leave is good public health, and we have got to change this. And I am hopeful, because I always see a silver lining in everything. And pandemics big pandemics always change societies. They just do. And I am hoping that this one wakes up our country to see that some of our policies and our trajectory towards greed over human life is not sustainable. It's insane. And I hope that people rise up and start looking at that, because we cannot continue like this. And we are going to see part of what allowing, everybody not to have health care, not to have decent paying jobs, not to have homes. I mean, it's a very hard thing in public health all the time when we have to help people recover from diseases and they don't have homes.
So we know we are in I'm sorry, Director, were you going to say something?
I started with.
Oh, okay. No, you can jump in at any time, because these are questions that people are really trying to figure out what to do. Because of your point that you just made, Julie, that a lot of people don't have sick time, sick leave, unfortunately, in our community, it's easy for us to say stay home.
Right.
Yeah, exactly.
What should the community do to help those who really just don't have those resources, even though they really need to stay at home? What's the message for communities? What should churches be doing right now?
I think helping people, I'm sorry if you directed that, Julie, but
It doesn't matter.
No, go ahead.
Please.
I think helping our neighbors and our friends with childcare, helping with if someone's ill, visiting them, bringing them food.
Dropping the food off at their door.
Thank you, and ringing the bell and running away.
Right, not visiting them.
And then Julie, you could add more.
Well, but this is more than communities can handle. This is a structural problem with our economy, basically. It's way bigger than that, and we need to we need a legislative, look what they did in Italy. They're not being punished for not being able to pay their rents because they can't work. They're not being, people are still able to live when they cannot go to work. And there are a lot of times when people can't go to work, and we have to start considering that. And I do think this may be that wake-up call.
Well, I hope it is. We here at the University of Illinois community have a lot of students that are going on spring break. This is their last week. And they really need a message from us for spring break. I know there's been a lot of travel advisories that have been given from the federal government. What is our emergency management suggestion for those students at this time as they leave the campus and go home?
I don't want to speak for the university, but they've put guidance out, and it's not just the University of Illinois, it's also Parkland College here in our community. So they're asking students to heed the travel advisories, stay home if they're sick, don't come to class if they're sick, and just be aware of their surroundings wherever they're going. And that's the best advice, and wash their hands. And the schools right now are looking at, when they return, doing most of the classes online. So those are the kind of measures that are being done both at the university and at Parkland College. So we know that they're leaving, and we've also shared that message from the university and from the college to the regional offices of education, because we know as parents that this is also, when there's spring break, this might be a time to go visit colleges for our children that are expecting or looking into going to colleges. So we're trying to have one central message amongst the groups, especially dealing with spring break.
And college students should visit the public health department before they go on spring break too. Because we don't need the spike when you get back too.
You come back, so.
Because we always see that.
At Carl, we sent out some emails recently to our employees saying, we can't tell you not to travel, of course. We have stopped all non-patient care business-related travel. So we're telling people don't travel to a conference. They're all being canceled anyway,
right.
But don't go to a conference. We don't want people in large groups or have people on things such as airplanes where they might be exposed to this virus. We're telling people that do travel that you might go to a country right now that is not level 2 or level 3 CDC warning, but that could change. I mentioned earlier about this changing hourly. Literally, that could change overnight. I saw something today that the White House is considering naming all of Europe a level 3. So if that happens, if you're in Europe and you're having a great time, you're not around a place that has a lot of this virus yet, you might, when you come back, need to stay home for 14 days from work and from being around other people because you chose to go away. So again, can't tell people not to do things, and it's very individualized. Some people have put a lot of money into travel and they can't cancel, and it would be very detrimental to them if they were to cancel. Be safe, do the same kind of things that you hear from Julie and others. Wash your hands, keep away from people, don't shake hands, do elbow or leg bumps that I've seen on TV or on the internet. So I just wanted to throw that out there.
I think today, Governor Pritzker at his press conference announced the state was discouraging any public gatherings of 250 or more. Would you agree with that recommendation?
Yeah, that's reasonable. I think that's very reasonable. The idea gets into the social distancing concept. So one thing it would be people traveling and either people bringing the virus into a community or taking it back home to their home community if they've been traveling. The other issue is social distancing, 6 feet away, not being in closed, confined spaces. It seems that is one thing that does promote spread of the virus. So it's very reasonable.
So I think we have covered quite a bit in the questions that I have before me. I'm wondering if there is a way for folks to let their skills or the volunteers in our community who want to do something, Julie, what should they do first? Because we don't want everybody to run over to public health or to Carl Hospital and say, I'm a volunteer right now.
No. So this is such a wonderful question. And again, I keep saying this, and it's so true. We have the most innovative kind and generous community out there. And we have so much talent. And people are calling me or sending texts with ideas all the time. But what we're going to need to see is some leadership in the community. It cannot be at public health, and it cannot be at the hospitals, and it cannot be at emergency management, but it's going to have to be somebody step up, whether it's a religious organization or a church, or whether it is, some other agency, I don't know. But we're going to need a ton of help with logistics for getting the food boxes out to the families if we have closures. We're going to need volunteers. We're going to need money. We're going to need, for things that we don't even know we need money for. Public health, we will have money to throw into a lot of things, but we don't have money to feed the entire county. So there are things like that. We are going to need people to check on their neighbors, just like he said. Get together now before we have virus, known and circulating in our community. Meet your neighbors. Talk to your neighbors, share phone numbers. If something happens, a neighbor can drop off food at their house. We need to start looking at things like that. We are going to need counselors. Everything from a volunteer who will just do phone companionship all the way up to psychiatric counseling online. So we are going to need this whole spectrum. We're going to need tons of people answering the phones. Who knows, if we go into some kind of massive quarantine like they're doing in Italy, we're going to need people doing all kinds of stuff. So make yourself known once an agency emerges, and it will. I know it will. Once that place emerges, let us know. And churches and religious organizations are great places, and so are employers, and so are clubs. Anything that you need to look out to your sphere of influence and make sure that they're preparing, and if they can't prepare, help them prepare.
I don't have additional questions unless the senator has, and then I'll just make a couple additional announcements about the VA.
Okay. I would also say that I spoke with Jim Hires from the Eastern Illinois Food Bank today for this very question. I had a very kind person today. For all the people that are worried about stockpiling things for themselves, the person stopped me and said, well, how do we help other people? So I called Jim Hires, and he said, well, there's neighborhood food banks, or food banks, and if you call the Eastern Illinois Food Bank, we'll be able to direct you to your local food pantry, and that might be a good place to start, but I agree, we need a network.
Yeah.
We've asked a lot of questions, but I would imagine there's something we've missed. And so what I wanted to give is each of the panelists a chance to address anything that they think our watchers, our viewers should know or should do that we haven't talked about yet. Anything?
John, you want to start? Do you have anything?
Kind of restating, just be a good neighbor. Take care of yourself first, take care of your family, but don't be afraid to reach out to your neighbors. This day and age, it's, how many of us know who lives 2 houses down, much less the house next to you. But get to know those folks and start small, and then we can branch out to help others. And then keep in contact with your organizations. Julie, like I said, we've done a lot of outreach, whether it's to long-term care facilities, the schools, as well as religious organizations. I know we have one of the local churches is going to do a webinar similar to this tomorrow. That's been opened up to our religious houses of worship out in the community. So also make sure that you get the information from trusted sources like the CDC, the Illinois Department of Public Health. And then also...
Well, that's rude, John.
And, well, Public Health Public Health has a virus on their website. So
You still have a great Facebook page.
they have a great Facebook page, but their website is currently down. They're working it, which brings up a good point as well. If it's too good to be true, it probably is. So unfortunately, there are folks out there who will try to take advantage of the situation. So take the information from trusted sources. Don't click on links that you're unsure about. But take the time to do research to make sure you're making the best decision with the best information you have.
I'd say my message would be phone first. If you feel like you need to come to the doctor's office, call and talk to us, and we'll direct you to the best place to go. I would stock up or make sure you have your prescriptions on hand and talk to your doctor and your healthcare provider about getting extra prescriptions or getting a refill maybe a little bit early. It's tricky because insurance companies have different rules, and the answer is always it depends when people ask me what the effect of that will be. But if you're able to, I would get extra prescriptions. And I guess the last thing I would say is this is really serious. We're going to be affected by this virus very soon, and I think we can't just think it's, I've heard other people say, just a couple extra pumps of Purell. That's not what we're dealing with here.
Thank you. Just great points and great advice, certainly from both of you. Thank you. My comments would be three things. If you have a cough, cough into your elbow, not your hands. Practice practice avoiding touching your face. Harder to do than you
Very
think.
hard to do.
But yeah, so don't touch your eyes, your nose, and your mouth. And then third, just wash your hands. And again, wash your hands. We're talking about like 10, 15 times a day. So, not just after going to the restroom, okay? But multiple times a day.
Until they're raw back here.
Maybe. But yeah, so those would be my pieces of advice. Thank you.
Yeah. And my suggestion is to people is going to be listen to what we're saying when public health comes out with a message. Listen to that because it will be very thought out, whether it's a closure, whether it's self-isolation, whether it's quarantine. We need to make sure that people stay in quarantine. We've seen some issues in other places where people were put into quarantine and then they left quarantine to go to a dance, for example, and then they started an outbreak there. So it's very important to stay in that, and it's very important to listen to the messages. I can say that, public health, these measures are simple, but they are super effective and they've been going around forever.
I'll just end with a couple announcements. Again, reminding people, as our EMA director said, if it's too good to be true, it really is. Attorney General Kwame Raoul urged people to be very cautious about people marketing products to you during this time. Also be cautious about, as he said, clicking on different online marketing products as well. Again, there's no vaccine to protect against COVID-19 and no medications approved for treatment at this time. The doctor expressed tonight that it's in the works, but it is not ready. So please do not pay for any alleged COVID-19 cure or treatment that you see online. I'm also made aware of immediate release today from the Champaign County Clerk's Office. Aaron Ammons has consulted with the Director of Champaign Public Health and out of an abundance of caution has decided to close polling locations that are located at long-term care facilities. There are no reported cases in Champaign County at this time. However, this is a precautionary measure to protect the health and safety of a population with compromised immune systems. The following locations will not be polling locations for 2020 general primary election on March 17th, 2020. Clark Lindsay in Urbana, the Glenwood in Mahomet, Eagle View Retirement Home in Rantoul. The Champaign County Clerk's Office will redirect voters from Clark Lindsay to St. Matthew's Lutheran Church in Urbana, 2200 South Philo Road in Urbana. The Glenwood voters in Mahomet will be redirected to the Elks Pavilion at the Lake of the Woods, 109 South Lake of the Woods Road in Mahomet, and voters from Eagle View Retirement Home in Rantoul will be redirected to Gathering Place, 200 South Century Boulevard in Rantoul. We're asking the entire Champaign County community to help us get the word out about these changes in a responsible way. There are no reported cases, again, in Champaign County that have been confirmed, and this is just precautionary measures to protect the health and safety of the population with compromised immune systems. We are also encouraging voters to take advantage of early voting and the vote by mail option to help prevent long lines and large numbers of people in one place on Election Day, March 17, 2020. Early voting is open now, and you can go to the clerk's website to find out locations and times. And voters can call the office to request a vote by mail ballot, which is a good thing to do right now. Please request a vote by mail ballot. Please call Champaign County Clerk's office with any questions, 217-384-3720. That's 217-384-3720. Or you can call 217-284-3724 from Aaron Ammons, Champaign County Clerk. And with that, Senator Bennett will close us out.
Well, in that same line of announcements, the VA Ileana healthcare system does have a series of announcements. While the CDC still considers it a low threat to the general public, the VA Ileana healthcare system is paying special attention, and as such, veterans, visitors, and volunteers who enter the Danville campus will be pre-screened. So this is going to lengthen entry time, so you need to come early if you do have appointments. And all veterans, visitors, and volunteers will only be allowed to enter through the main entrance of Building 98 from 6:30 a.m. to 4:30 p.m. and Building 102 for 24 hours a day. Employees are going to have to show their IDs, and veterans, visitors, and volunteers at other VAs throughout Central Illinois should expect similar processes to be admitted. Additionally, large group public events related to veterans over the next 30 days are going to be canceled to reduce foot traffic in the medical center at the VA Ileana healthcare system. There's a veteran town hall at the Champaign Public Library next week on March 16th. That has been canceled, as well as the Vietnam Veteran Commemoration Ceremony, which is going to be in Danville on March 27th. That has also been canceled. Again, those of us, those viewers that are still with us, thank you for getting the best information and hopefully passing that on to your friends and family instead of relying on some less reliable sources out there. And I just wanted to say, on behalf of Mr. Dwyer, Dr. Healy, Dr. Jokala, Director Pride, and of course, my legislative partner, Representative Carol Ammons, thank you for joining us. Be well and look after one another.